Hey guys, and welcome to another session. I'm Chrisbel Davis, the recruitment coordinator here at the University of Arkansas Pulaski Technical College. Today, we're getting medical with the Allied Health Department with our special guest, Miss Talayia Johnson. She's going to be giving you tips and ways to get connected with all the things over in Allied Health. They have some really great programs and some really great opportunities. This is being recorded, so we will repost. So feel free, April or Latoya, if you have any questions, to put them in a chat box or go ahead and jump on and ask them. This is a great opportunity for you to get to know all the information you need. And so, yeah, without further ado, I'm going to get out the way. I've said all that I have to say. Miss Johnson, take it away.
Hey guys, how's everybody doing today?
Good, excited for this informational session.
Good, excellent. All right, so I am going to talk about all of the programs that we have here in our Allied Health building on the UA-PTC North Little Rock campus. And so as I'm going through the programs, if you have questions about the specific programs, feel free. If you look over in the chat option, there is an option to raise your hand. And so if you want to raise your hand and ask a question, feel free to do that. And I will ask as we go along. Or if you would like to type in your question, you're welcome to do that as well. And then we, between Chris and I, we will get to those questions at the end of the presentation. So you can do it however you like, whichever is most convenient for you. All right, so the first thing I'm going to talk about is our Allied Health Department. Our Allied Health Department, we are here to prepare competent professionals to provide collaborative healthcare needs to our community. And so if you are interested in healthcare in various realms, you can contact admissions and inquire about our technical certificate in pre-healthcare studies or our certificate of proficiency in pre-healthcare studies. Both of those both the certificate and the certificate of proficiency and the technical certificate provides you with the classes that are the basis or the entry classes, the prerequisites that you need for many of our allied health programs. And so many students are, they enter the school, they enter UA-PTC with the desire to enter allied health. And so you have the opportunity to, you can go the Associate of Science and Liberal Arts and Sciences route, or you could do a technical certificate in pre-healthcare studies or a certificate of proficiency in healthcare studies as well. So there's lots of options depending on what is, what best fits you and what best fits what you have going on. You can, you can choose whichever route you like. So our first program, I am starting with this program first because this week is National Respiratory Week. And so because this week is National Respiratory Week, I am starting with our respiratory program. So our respiratory program, it is located on the second floor of the Allied Health building. The program director is Dana Beard. She accepts 24 students into the respiratory program each year. The application is an online application, and the application is due each year by May 15th. It's due each year by May 15th. The program itself, the respiratory portion, is a year. They start in the summer, so it is summer, fall, spring. And so you do the whole summer, the whole fall, and the whole spring, and then you graduate in May with your Associate of Applied Science in Respiratory Therapy. It is, of course, a very booming program right now, just based on the things that are going on in our country that's related to COVID-19, because it is a respiratory disease. And so there are lots of people who have become interested in respiratory therapy due to what we have going on in our country right now. There are several prerequisites that are required for our respiratory program. And thank you, Chris, for putting Dana's information on the screen. You can get more information about respiratory therapy at www.uaptc.edu/respiratory, or you can definitely contact our program director, Dana Beard. So that is our respiratory program. The next program that we are going to talk about, this program is beneficial for people who are interested in healthcare, but they don't want to do hands-on patient care. And that is our health information technology. Our health information technology program, it is led by the director, Ms. Dr. Kathy Trawick. Dr. Kathy Trawick is our program director for our health information technology program. Health information technology professionals, they are experts in managing patient health information and managing healthcare records. And so they are our computer specialists. So when patients come into the hospital, or if they come into a doctor's office, those people who are sitting either at the window or at the desk that helps to check people in, those are our health information technology specialists. They work in hospitals, they work in clinics, they work in rehab facilities, they work for insurance companies because they help with the reimbursement of for medical procedures. And so they are very important in our healthcare because they help us to facilitate information between provider and information and patient. And so the Health Information Technology program is an associate degree program. It can take anywhere from 3 semesters if you're full-time to 8 semesters if you're part-time. And so depending on how fast you want to go or how slow you want to go, you can determine, how long your program is. The other benefit to this program is the program is all online. There are no requirements to be on campus. So this is an all online program. And this program starts every semester. So they have a summer start, they have a fall start, and they have a spring start. So if you decide at any point in the year that you are interested in health information technology, you can start this program at any point in any semester, at any point in the year. And so that is very beneficial for students, the fact that it's online as well as you can start at any semester. So our next program that we are going to talk about is our surgical technology program. So our surgical technology program, it is an associate of applied science in surgical technology. The program director is Ms. Mashana Conley. She is our program director. They also accept 24 students each year into the surgical technology program. So the surgical technology program, of course, is located here on the main campus. It is designed to provide students with knowledge and skills related to the operating room. So you can work in the operating room in like general surgeries. You can work in labor and delivery, delivering babies, like if someone is having a cesarean section. You can work in outpatient surgery centers. So wherever there is the opportunity for a surgery to take place, a surgical technologist can be used. When you finish the program, you're eligible to take the Certified Surgical Technologist exam. But just because you finish the program does not mean that you will pass the certification exam, because you do have to study for the exam. So it's important that you retain the information so that when you are complete with the program, you're able to pass that exam. This is a 4-semester program. The surgical technology program is a 4-semester program, and they start in the fall of each year. So they start in the fall of each year, and they go fall, spring, summer, fall. Okay. So that is our surgical. No, I'm sorry. I apologize. They go fall, spring, fall, spring. So it does not include summer. It is fall, spring, fall, spring. Okay. So that is our surgical technology program. The next program that we are going to talk about is our dental assisting program. Our dental assisting program, it is one of our big programs that people are interested in. And it is because they require no prerequisites. So there are no prerequisites to dental assisting. A lot of our students, they come right out of high school and they go straight into our dental assisting program. And so our dental assisting program is 2 semesters. It begins in the fall of every year and they graduate in May of every year. So it is just fall and spring. It is just 2 semesters. There are no prerequisites to the nursing program. Our program director is Miss Talayia Johnson. And so in order to get into the program, you must test into college level courses. So that's the only requirement, is that you test into college level courses. So when you take your Accuplacer or when you take your ACT, you must test into college level courses and not require any developmental courses. Upon graduation, you meet the requirements to sit for the Dental Assisting National Board Exam. Dental assistants are used in dental offices everywhere. They are a very important part of the dental healthcare team. They help to increase the efficiency of the dentist. So if you've ever gone to have any procedures done at the dentist, you notice that they have someone helping them to set up the trays, to prepare for whatever the procedure is that you are about to experience. And so those people who are assisting the dentist, they are called dental assistants. Most dentists utilize or use 2 or 3 dental assistants at any given time. And so there is a very high demand for dental assistants right now. And so that is a booming field at this moment. So you can work in general dentistry, you can work in pediatric dentistry, you can work in oral surgery, you can work in orthodontics. So there are lots of options for someone who is interested in being a dental assistant. So our next program that we are going to talk about are our EMS options. EMS stands for Emergency Medical Services. Emergency Medical Services. Our program director for Emergency Medical Services is Mr. Harold Shrey. Mr. Harold Shrey. There are 2 options in our emergency medical services. There is the EMT option, and that is emergency medical technician. And then there is our paramedic option. And so we'll talk about the differences in the 2. The EMT option, that is a 1-semester course. And they have that 1 semester course is every fall, every spring, and every summer. Every fall, every spring, and every summer. It is a 6 credit hour class. And once you take the 6 credit hour class, you are eligible to test for the National Registry and get your Arkansas license as an EMT. Jobs are plentiful throughout the state. These are the people that are on the ambulance, the EMT, along with the paramedic. They are on the ambulance. So these are the people who train in the field that you see, who are helping people who may have had a wreck or who come to the house when someone is having a medical emergency at home. Our paramedics, also, they work with our EMTs. The paramedic program is a 3-semester program. It's a 3-semester program. And so it is fall, spring, summer. So it starts in the fall. It is fall, spring, summer. And that requires an EMT license to enter the program. And so in order to get into the paramedic program, you must complete the EMT program, the EMT class first. So that 6 credit hour class is required in order to get into the paramedic program. There is a nationwide shortage of paramedics. You are able to be employed in various areas, both in rural communities as well as urban communities, as well as our big cities, small areas. And so these, our paramedics, they are needed very, very widely. And so because there is a nationwide shortage. Okay. The last program that we are going to talk about in our allied health programs is our practical nursing program. I am the program director for the practical nursing program. My name is Talayia Johnson. And in order to get into the practical nursing program, well, first of all, we have 2 options for our practical nursing program. We have our traditional option. Our traditional option, that includes classes that are during the day, and the program is a 12-month program. And so that program starts every year in the summer, and it is summer, fall, spring, and then you graduate in May. So it is summer, fall, spring, and you graduate in May. The person to contact for additional information about the program would be our allied health advisor. Her name is Miss Susan Grafton. She can provide additional information about the options. Our second option is our non-traditional option. Our non-traditional option is a 4-semester option. It starts in the fall of each year. It is fall, spring, fall, spring. And so it is 4 semesters with no classes in the summer. That program is beneficial for students who need to work during the day because those classes are held in the evening. Classes usually begin at 5 o'clock or somewhere around 5 o'clock, and they go through 9:30 or 10 o'clock, depending on the semester. The first semester, the classes are 3 nights a week, and the clinical is on Saturday. The other semesters, the other 3 semesters, the classes are 2 nights a week, and clinical can be on either Monday and Wednesday, 2 6-hour days, or they can be on Saturday, our 12-hour days. So there are 2 different options. So our non-traditional option, we accept currently 48 students in our traditional option, and we accept 24 students in our non-traditional option. All right, so that is the information for our nursing program. Oh, by the way, our nursing application is online. And so when you go to the nursing website at uaptc.edu/nursing, there are two options. There's one option that says if you are a current UA-PTC student, and then there's another option that says if you are a new UA-PTC student. If you have not attended UA-PTC in the last 6 months, then you would need to choose the new UA-PTC student option. All right, any questions?
I have one question with the surgical tech program. The last 2 semesters, is that clinical type work?
Yes, so in the surgical technology program, there are 30 hours that are related to specifically to surgical technology. So the first couple of semesters, those are your prerequisite courses. So those are like biology, English, history.
So I'm taking all of that. I applied last year, but I wasn't selected. So I'm trying to stay ahead of the game, and I'm taking all of that stuff.
Okay.
Just on my own now. So I was just kind of curious when I apply again, going in, what to expect. And I thought it was clinical based, but I was just curious.
Yes, absolutely. So the like I said, the first 2 semesters, and so that's excellent that you are continuing to take those classes. Like I said, your A&P, your English, your psychology, sociology, math, all of those. The last 2 semesters, the third semester is 16 hours, and the fourth semester is 14 hours, and all of those hours are specific to surgical technology. So it includes pharmacology. You go to clinical sites, you learn, specifics about the instruments and how to work them, and you spend time in the actual OR in those last 2 semesters.
Okay, that's very exciting. Thank you.
You're welcome. Ms. Latoya has her hand raised. Yes, ma'am.
Having some technical difficulties. Sorry about that. So originally I started out on the LPN track, but when I was informed that I had to have comp and chemistry, I was like, well, let me just, if I got to have these classes, let me just do RN. But since this semester has started, I've honestly been back and forth with, do I want to do LPN, graduate, get the experience, and then go later for RN? Can you refresh my memory on the required classes for LPN?
So the required classes, the things that are required are that you have to have a math class. So you have to have completed all of your developmental math. And so you have to have either taken mathematical reasoning or college algebra. Okay. And you have to have completed your developmental English classes. So you have to have taken either Comp 1 and finished the support portion before you can be eligible to enter the nursing program. If when you tested, you needed to take a developmental reading class, then you need to have completed your developmental reading class as well. So what we have, and so those are the requirements to be considered. However, what happens is we accept students based on a point system. And so we have at our website, uaptc.edu/nursing, there is a list of courses that will help you to gain points toward getting into the nursing program. And so those are Comp 1, Comp 2, psychology, sociology, college algebra, A&P 1, A&P 2, chemistry, microbiology, nutrition. All of those courses get you points toward getting into the program. So you can have completed all of the required courses, but still not have enough points to be admitted into the program, because we do have students who enter the program or who apply to the program who have taken mostly all of those courses. And the more courses you take, the more points you get, the higher you are on the list of people who are going to get accepted into the program.
Okay, all right. And then my other question was with the Kaplan exam, say if I did go LPN route, when is the deadline to register and have that taken?
The Kaplan exam is no longer required for our program.
Oh, I was not aware of that.
I know. And so at this point, as long as you have, if you have taken the ACT or the AccuPlacer, and you have already completed all of your developmental courses, there is not a standardized test that you need to take in order to get into the program. And so what we've done is we have replaced the Kaplan exam with the interview process. And so once you have taken your courses and you have completed the online application, once we rank the students from highest number of points to lowest number of points, then we interview the top 100 to 125 students. And then you get additional points based on how well you do in the interview process.
Oh, okay. Unaware that the Kaplan was no longer required, which is good because I've been freaking out about studying for that on top of school and everything. So
absolutely. And we heard that from a lot of students, as well as paying the $50 out of pocket was beginning to be an issue for students who may not have had the money to pay out of pocket or to take it several times. And so we decided that we would remove that barrier from students who were interested in the nursing program.
Okay, wonderful. I think out of my list of questions, you pretty much answered a majority of them when you were speaking about the nursing program. And then really I just had I did have another question. So when we're doing the application process, there's a question there and it says, select the type of student. It had like transfer, international. What option would we choose if we're currently a student at Pulaski Tech?
So if you are currently a student, it should say, go ahead, Chris.
You would just be a readmit. If anything, you would say a readmit student, and we'll just pull your current information from UA-Pulaski Tech. And
okay. All right, wonderful. Thank you.
Yeah, no problem. I just know that because they ask that a lot. And
they do.
Processing apps, we'll have to change it. So if you put anything else, it'll require documents that you may have already turned in, and that could put you behind in the process or frustrate you. So just do readmit, and we already have your documentation.
Absolutely. Also, speaking of the admission process, the application this year is due March 15th. So we have moved it up from it in previous years. It's been April 15th. And so now it is March 15th. And the reason that it is now March 15th is because our traditional program will now start in the summer rather than starting in the fall.
Oh, okay.
So you have from October 15th to March 15th to complete the application as well as to submit all of your documents.
Wonderful.
Awesome. You've asked some excellent questions.
Thanks. So may I, at the end of this, email you some way, somehow, so you can pull my stuff, pull my classes and make sure I am on track? Because I think I want to change my mind and go LPN route so that way I can get that experience, and then later on transition to RN.
So absolutely. And so the person that you would contact to pull your information would be Susan Grafton. Her information is in the chat. Her number is 501-812-2745. Or you can email her at sgrafton@uaptc.edu.
Okay.
And so she will be able to pull your information to see what you have. And if she is unable to pull it, then she will come and talk to me and I will help her to get that information. But she is our allied health advisor, and she meets with all of our nursing applicants to make sure that they are on the right track, that they are taking the right courses. She helps them to calculate their quality points so they can see how many points they have toward getting in. She'll schedule the interviews once we get to March 15th. So she'll do all of that, that precursor stuff to getting admitted to the program.
Okay, thank you.
You're very welcome. All right. So you ladies have been wonderful. I definitely appreciate that you have attended this information session. And if you have any questions, here are, let me share my screen. Here we go. So there are the contacts for all of our allied health programs. So remember, our allied health advisor is Susan Grafton. She can provide information for nursing, respiratory therapy, and dental assisting. And then the other programs, Dr. Trewick for health information technology, Ms. Mashana Conley for surgical technology, and Mr. Harold Shrey for our EMS services.
Thank you very much for the information.
You're very welcome. Thank you.
Have a great day.
For joining. You as well. Have a great day.
Thank you. Y'all have a great day.
All right. Thank you, LaToya.
Thank you, guys.
Bye-bye.
Thank you.
Bye-bye. Thank you, Chris. I appreciate you.
Yeah, no problem. This was great.